Hi, Dr. Kyle Kiesel here with the Functional Movement Systems. I'm a physical therapist and a researcher. I've got a PhD in rehabilitation sciences. I'm very excited to bring this clinical integration series to you, or introduce this to you. We have created clinical integration to teach you how to blend regional-based diagnosis, the current best evidence for each of the regions, low back, neck, shoulder, and lower quarter, with the functional movement systems. And of course, that's primarily going to be the SFMA. So we want you to take a look at this. I go into good depth of the background of why and how a little bit in the low back piece. But for now, let's focus on the neck course, all about neck pain, right? So this is maybe only about an hour, and we go deep into the evidence of how you're going to get your patients into the appropriate category to emphasize the treatment that they need at their neck, right? Now, as many of you know, neck pain has so many relationships with other areas. Well, the SFMA is going to get that for you. You will not miss a thoracic spine problem, etc. with the SFMA. So that takes care of the regional piece, and then you can focus in on either a patient that has primarily a mobility problem, primarily radiating pain, so maybe like a disc problem if you want to give it a medical diagnosis. Movement coordination impairments, that's higher pain in people that don't move well. Well, guess what? Movement coordination problems are often SMCDs from the SFMA. So a ton of what we do in this category is our level 2 SFMA 4x4 retraining. That's almost everything that we do there. And then the headache category, and headaches end up with a lot of manual therapy. And so these two end up being kind of tied together. So rather than take the medical diagnosis and try to treat from that, we're going to make sure you follow the research. This is all based on clinical practice guidelines, and get your patient into the correct category. Now, the other beautiful thing that you get from the SFMA is that upper cervical and then the rest of the cervical and thoracic findings. So you're going to know the upper cervical findings in all these patients from your SFMA, and you can blend them right together. So it's just a beautiful fit. Sometimes these neck pain patients could be a little challenging to treat. So again, we're going to be sure you don't miss anything big. We'll review the big red flags and things from the evidence, but we're going to hit you and be sure you can get them into each of those categories. Coming back to the SFMA, then we've got to discharge patients appropriately, because we want to think about ourselves as musculoskeletal healthcare providers, and we're going to prevent problems going forward. So again, low back is really the details of all this. The neck pain class, get them in the right category, work your way back to appropriate discharge.
Hey guys, if you like the video, definitely hit the thumbs up. And if you want to stay informed, hit the bell so we can notify you anytime we put up new videos. And of course, any questions or comments, put those at the end. We'll certainly be checking them out and trying to respond. Thanks so much. And remember, always move well and then move often.